Hey everybody, this is Lisa Norton, nurse practitioner student at Auburn University. Today we're going to discuss Gilliam-Bare, which is better known as and pronounced as GBS, and can be tied to a cute little acronym that goes with that, gradual blocking of sensation, which is exactly what it is. It is a demyelination that occurs due to recent infections. While the body is fighting off infection, signal interruption occurs within the myelin sheath of the nerve, which causes breakdown of the sheath or demyelination. No signal occurs as a result of this in response, and the result is paralysis. What population can Gilliam-Bare occur in? All populations, all types, all ages, all nationalities can be affected. GBS is known worldwide. Mostly young males are affected by it, but anybody can actually get it. 3 key questions in the assessment of GBS is: where are the symptoms starting? It usually begins in the extremities, such as the feet. You'll notice tingling and numbness in the hands and feet usually first. It can also start in the fingers, face, and arms. One of the big things you're going to look for is an absence or diminished sense of deep tendon reflexes. That is a key finding. Another question you want to ask is it symmetrical? Both sides of the body are affected equally by this. As with neuropathy, can be painful also symmetrically. Produces numbness to the point of paralysis symmetrically. How do symptoms progress? This progression makes this condition critical. The progression causes numbness and paralysis. It progresses maybe over a 4-week or longer period. It can affect every muscular part of the body, even muscles that you're used to breathe and to swallow with. 20 to 30% of patients require ventilatory support, and this can even cause death. And one more key question in this assessment of GBS is: has the patient had a recent infection? 40% of cases stem from a Campylobacter jejuni infection, which is a gastric bacteria caused by undercooked poultry. Assess the patient for any gastric illnesses. Also, flu virus, cytomegalovirus, Epstein-Barr, hepatitis A, B, C, and E, HIV, mycoplasma, and Hodgkin's lymphoma. Symptoms are going to include difficulty with eye muscles and vision, difficulty swallowing, speaking, or chewing, pricking or pin needle sensations, pain that can be really severe, particularly at night, coordination problems, unsteadiness, abnormal heartbeat, abnormal heart rate or blood pressure, problems with digestion, bladder control, and absence of deep tendon reflexes. The diagnosis part of Gilliam-Bare is what you're going to do is, if you even suspect GBS, the patient should immediately get a neurology consult and expect that patient to be transferred to an acute care facility right away. Do not hold treatment while waiting for test results. Prompt treatment is essential to a positive outcome. As far as diagnosing, there's 3 different really important parts of diagnosing. The first very important part is the physical exam. You're going to assess for abnormal sensation or absence of sensation. Pain and numbness, tingling in the feet may occur even before the weakness starts. Absence or diminished deep tendon reflexes. Assess for recent viral infections, including diarrhea. Another part of the diagnosis, the second big part of the diagnosis, is a lumbar puncture. You're going to look for elevated protein in the CSF. You're also looking for other infections that may cause brain issues. You're going to also do the third part of it would be a nerve conduction study. You're going to look for reduced speeds of response at which the signals pass through the nerves. This is going to result in either a low or a slowed signal. As far as treatment is concerned, there is no known cure for GBS, but therapies can lessen the severity and shorten the recovery time. As far as treatment is concerned, some things you can do. Number 1 is a plasma exchange or plasmapheresis. This is similar to dialysis. This is where you remove the blood, cells are returned to the patient, but the plasma is not. The object is to remove the plasma. The plasma contains the antibodies that are refueling and the ongoing neural breakdown. Also, treatment is going to be IV immunoglobulin. Large doses are given that have been derived from many other donors. New antibodies go in, take over, and block the ongoing damage. Now, note that it doesn't correct. The damage is not corrected by this treatment. It's just halted. And life after GBS, recovery rates are about 60% recover completely, 84% regain ability to walk by themselves after a year. Many have long-term lasting effects due to nerve damage, and there is unfortunately about 3 to 5% mortality rate depending on where the patient lives. And that is the end of Gilliam-Bare. Thank you very much.